Hi guys, this is Rochelle Craig from the training department, and I'm here with Amy Morozic, and we have created this video and handouts due to requests for reviews of a few topics: case building, guarantor and insured party, and end of day. For most of you, this will be a refresher, but we do realize that it may be new information for some specialty areas. So after reviewing the video and handouts, please feel free to contact us if you have any questions. I'm going to turn it over to Amy to do case building.
Hello, everyone. The best part of case building is getting organized and knowing when and how to build the case. We build cases for three reasons: for specialty authorizations, referrals to track visits, for auto accidents, and for workers' comp. The first type of case we're going to talk about is specialty authorizations and referrals. Your insurance should already be loaded in demographics. How to build the case. If you go into the patient's registration to edit and case management, you get a pop-up and you can pick the new button at the bottom left to start your case. You're going to name your case by specialty, doctor, and year, or by insurance and year. And your example could be Cairo, Dr. Jaramita, 2017, or VBH, 2017. The notes box at the bottom of the case tab is used for any information that pertains to that particular case. Maybe you talked to a representative and you had 6 visits for a certain referral, and now they've extended it 4 more visits. Or you had 10 visits before an authorization is required. The next tab would be the insurance tab. You're going to uncheck all the insurances that do not apply to this case. If this case requires an authorization or a referral number, you're going to highlight the insurance, hit the edit button, and you get a pop-up window for a place to enter the authorization number with the beginning and ending date, or a referral number with the beginning and ending date. On the same insurance carrier tab, there is a place to set the doctors and mid-levels for your location. The next tab will be your authorization tab. And this tab is kind of misleading. This is basically only for the number of visits if the case you're building requires a number of visits. You hit the edit button and put the number in. Our next and final tab will be our visit info tab. Your allocation set should be set to the specialty copay if there is one for that specialty. The financial class should also match the insurance, and this is where you can enter a referring physician. And this completes a specialty case. Now, the next cases we're going to talk about are going to require verification, and this is for auto accidents and workers' comp. Auto accident claims generally have a dollar amount attached to them, and there are worksheets available on SharePoint under the front office policies and procedures, and also in handouts in EMR. If you use these worksheets, there are hints on the worksheets on what tab when you're building the case to put your information. First, we're going to take an auto accident, and you're going to make sure that the insurance is entered into the patient's demographics in registration. Then you're going to go up to Edit and Case Management and build a new case. You're going to name your case AA for auto accident and the date of the accident, and you're going to enter the claim number on the claim number line. And the bottom notes should be used for anything that is pertaining to the case. Specifically, if you have a case management person that you can call at the insurance company. The next tab is going to be your insurance carrier tab. You're going to uncheck all the insurance except the auto insurance and set your doctor and mid-level. Now, for certain specialties for auto, you may be required to obtain an authorization or a referral, and you will put that information the same way. You would hit the edit button on your auto insurance and enter the number, and if there's a beginning and an expiration date, enter that also. The next tab is an authorization tab. Primary care for auto generally is not limited by visits, but by dollars. So this is generally skipped. But if it were a specialty that did limit the number of visits, this is where you would enter it. Our next tab is our visit info tab. The allocation will always be set at an insurance 100% for an auto accident, and your financial class should be changed to auto accident. And on the Filing 1 tab, you're going to enter the date of the accident under date of illness current, and you're going to put a bullet in the accident and bullet auto and enter the state. When you do this, your case is complete. You can say okay, and then in registration, you're going to uncheck that auto insurance, and that completes an auto case. And last but not least is workers' compensation. Workers' compensation cases are built differently. Do not enter the insurance into the patient's demographics. When you go up to Edit and Case Management and New, on the Case tab, there is a workers' compensation box you need to put a check mark in, and watch your tabs across the top change. Then you're going to name your case, WC for workers' comp, and the location of the injury. And your notes section, again, would be used for information, who the case manager is, and a phone number, and any information on the employer or about the workers' compensation case. The next tab is your workers' compensation tab. Your claim number goes at the top left, along with the date of injury. And then on the right-hand side, midway down where insurance carrier is, this is where you will search for your workers' comp insurance. When you find it and enter it, the address auto-populates on the left-hand side. Then the same tab, you set the doctors and mid-levels from your location for this workers' compensation case. And again, our next tab is going to be the Visit Info tab. And you're going to put allocation setting at 100% insurance and financial class set to workers' compensation. And on the Filing 1 tab, you are going to enter the date of the injury and make sure that there is a check mark in employment. This completes a workers' comp case. Now, for future appointments, for behavioral health specialty appointments, they are all attached by the billing department. For medical specialty appointments, they are attached on the schedule by the office staff. For all auto or workers' comp cases, future appointments are attached by the staff for all specialties, including medical, dental, and behavioral health. And that concludes my refresher on building cases. I'm going to turn it over now to Ms. Rochelle.
All right, so we have noticed some issues. We're trying to avoid duplicate accounts, and we're just going to refresh you guys on the correct way to look up patients. Now, we want to remind you guys, do not use the shortcut when you're creating new patients. This is how you get duplicate accounts. Now, on the screen, this is the correct way to make a new patient. Note that we are in registration. We searched the patient, didn't find them, so you would hit New down in the bottom left corner. The wrong way is when you go into the schedule and you click on the time and you search that way and you don't see them. This is an example of the wrong way. See location of care is all. Now, this is wrong, and if you see this, you want to cancel out. And just as a reminder, do not use punctuation in any registration fields. On the billing side, this will cause the claim to reject. Empty fields in the guarantor tab and also under other insured party tabs will cause the claim to reject. So you want to make sure you have in date of birth, address, sex, and relationship. Additionally, don't use any punctuation in the insurance ID field. For example, some insurances have a dash in it with the numbers, so just omit the dash. And same with the referral ID field that is in case building. And this is an example of the guarantor tab. You just want to make sure the address is there along with the patient's relationship to guarantor, birth date, and sex. And this is an example of the insurance tab. So you want to make sure the birth date, address, and sex are listed for the other insured party. And now with the end of day, everyone is now using Phreesia, so we just want to do a brief overview. So your end of day should consist of your written daily cash log, the deposit slip from CPS, and the daily balancing sheet from CPS, and that's what you find under reports. A copy of your written bank deposit slip, patient receipts and credit card slips, and then your Phreesia Collections daily reconciliation report. Everything should match up and balance. If they don't, please notate on the daily cash log if you have an idea of why. For example, you find a discrepancy and you know you sent in a refund request that day, just write on the daily cash log that you sent in for a refund. And as a reminder, add your Phreesia payment plans onto the daily cash log. So just at the end of the day, when you're reviewing everything and making sure it matches up and you see that there were payment plans withdrawn and added onto your Phreesia batch, that you write it on your cash log. And any posting errors through Phreesia, you have to fill out a refund form request on SharePoint. So once you have done this and it is sent to billing, they take care of everything else. So to get to the refund request form, you just go to SharePoint, the Forms directory, and Refund Request. Now, if you guys have any questions, please contact us at the training department. Our names are Rochelle Craig and Amy Morozek, and we'll be here to answer any questions. Thank you.
Thank you.